Hi, and welcome to week 8 of PA122. We are in Advanced Pharmacy Practice Book. Hopefully you already have this book. Week 8, yeah, you should have it. Sorry, I was just lecturing in a week 3, so you're in chapter 6 of this book this week, Home Health Care. And I wanted to talk to you about a little bit about home health care. So it starts on page 121. If you want to follow along with me in the book, I'm going to highlight a couple sections that I want to talk about. Home health care is one of the fastest growing segments of the healthcare market. More and more serious medical problems are treated outside the hospital setting and in the home. So why are people trying to stay home instead of in the hospital? A couple reasons here. Hospital, when people go in, sometimes they get sicker. You know, have you ever heard hospitals are the dirtiest places to be? And hopefully you don't have to stay there for too long. I just went in to have a baby last year and was out 2 days, something like that. So really we go in there for major surgeries, emergencies, but we're trying to do a lot of home health because people heal better in an environment that they're used to and that they're served good food and where people around them are taking care of them. And not that the hospitals don't do that, but we can handle a lot of it at home, and this is where the pharmacies can step in and really start these specialty healthcare programs and help people stay home. So it's, a lot of increased number of elderly. Every time, you hear this all the time, every time an elderly person goes into the hospital, they get pneumonia. It's like, and pneumonia at an elderly age can kill you. So we want to keep them at home. Anyway, so the elderly are staying at home. It lowers our cost. Physicians are now accepting it. And so the pharmacies can now help deliver medicines at home. We can have machines working at home. There's nutrition programs now at home, hospice programs, dialysis, ostomy, wound care programs, breast cancer recovery. You can go through all of them starting on 123, the types and the specialties of them. It gives you some examples of some other selections of home health care that you can read off of. But let's see. The role of the pharmacy. This is where we need to be really looking at. Pharmacists and retail pharmacy practice have provided home health care for decades. Canes, crutchers, walkers. These are the supplies that we see in regular pharmacies. These are home health, but now we can do more with patients at home. Along with the growth in home healthcare industry, some pharmacists have expanded the home healthcare services that they provide. They provide a full range of durable medical equipment, nutritional care. However, all pharmacists who provide home health care services share the same goal to ensure safe, appropriate, and effective use. There are some now that are selling chairs that help people get up. There are some now that are selling beds that are helping people get up. So you can, work in one of those pharmacies that do. But if you worked at a Walgreens, they don't have a lot of home health care. They just don't have a lot of space to put that. So maybe in a retail pharmacy setting that is a smaller pharmacy, independently owned, they would maybe do something like that because they would have the floor space to do that, and Walgreens doesn't. Here's some examples of that on page 129 of what a pharmacy might cover. Home diagnostics products, first aid supplies, wound care, oxygen therapy is a big one, nutritional therapy, and that kind of stuff. And then you go into your self-assessed questions. Make sure that you look under your assignment because that is where you download the page of the self-assessments at the end of the book. So make sure you look at that. Also other things, there is a quiz due this week, and then your discussion question, ask about a couple questions about a patient having surgery and then going home to home health. The one question that I thought was really interesting was, how can we get people their medication right after they have surgery? Do they really have to take a paper prescription to the hospital, to the pharmacy right after they get out of the hospital? Ugh. I used to work for a pharmacy who is called the Corner Drugstore, And they offered this specialty service where the doctor would send over their prescriptions. They knew they were having knee surgery the next day. Doctor knew exactly how to write for it and exactly how much pain medications they would need because they did these surgeries all the time. So we would fill it, and I would say, I would go to the waiting room and I would call the patient's name out and I'd say, I got your Percocet ready for you, your pain medications when you leave today. And you would look at me like, thank you. The families would be like, thank you. What a service that I provided for them to bring them their pain medication so that they don't have to stop on the way home after they've had this knee surgery, leave their patient in the car to go fill a prescription that they might have to wait almost an hour for, especially if it's a busy time. What a service. And so I think more and more pharmacies need to do this for their patients. All right, that's my discussion for you. I hope to hear from you about what some good ideas might be. And then quiz, assignment, read your book. Have a great week. See you soon.